I'm Khushalani. I'm the section chief for soft tissue and melanoma within the Division of Medicine at the Roswell Park Cancer Institute. I'm an associate professor of oncology at this institute, and my clinical practice is devoted entirely to the treatment of patients with melanoma and soft tissue sarcoma. So one of the important things that we're discussing today is something referred to as the abscopal effect of radiation treatment in melanoma, which was reported in one of the premier journals, the New England Journal of Medicine, earlier this month. Melanoma has seen a lot of excitement in the last year. This was a disease that traditionally was considered to be refractory to treatment. We did not have too many treatment options. In the past 1 year, the FDA has approved 2 new drugs, ipilimumab and vemurafenib. Vemurafenib is an oral pill taken by mouth that was approved in August, September of last year. And that is specifically for a subset of melanoma patients that have what's referred to as the BRAF mutation. This is a protein that is seen to be abnormal in approximately half the melanoma patients, and this drug works well, albeit not for a very long time. Ipilimumab is a form of immunological therapy, so what that does is improve the immune system and prime it to try and target the cancer or the melanoma cells and benefit the patient in that manner. And this was tested both in patients who have never seen any prior therapy for their advanced or stage 4 melanoma, as well as in patients who had seen treatment previously, and both subgroups of patients benefited from this drug, leading to FDA approval in March 2011. The response rates, which means the probability of actually shrinking the cancer down, are not robust. They're only about 10%. But in those 10% of patients, the patients who do truly exhibit a response, which sometimes can be delayed for 3 to 4 months after their treatment, many of them actually can go on to have long-term disease control. So that is very exciting. So the real question from a research standpoint on the table is, how do we improve those response rates from 10%? And this new paper that was published gives us some light on that. This was a single case study at Memorial Sloan Kettering Cancer Center, where a young lady with melanoma had already been treated previously with chemotherapy. Unfortunately, her disease started progressing, and she had a spot that was very close to the spine that was increasing in size. That is an area that we are concerned about, as it can compress on the spine and cause paralysis. So very appropriately, the doctors treated her with radiation therapy to that area. And interestingly, what they found while she was still getting her previous ipilimumab therapy is that other sites of disease that were not given radiation actually started to shrink down. This is something that has been described previously, although not very frequently. It's referred to as the abscopal effect. But the smart doctors who took care of this lady also went one step further, trying to understand why this specifically occurred. So they looked at the cancer tissue, which means the tumor tissue, for a specific type of protein called the NEJM protein. And hers was positive, and it has been shown that immunity to the NEJM protein may predict for a response to ipilimumab. So they were then looking at blood antibody titers as well as titers of lymphocytes, which are the part of our immune system that help fight against cancer cells as well as fight against infection, and found that there was a very nice correlation in this lady or in this patient before and after the ipilimumab treatment. I think it's still too early to draw conclusions from this single case report, but this is how good discoveries are made, and it gives us impetus to continue studying the disease that has devastated many people, and hopefully eventually try to find a cure for it.